Every day, millions of people wake up before the sun rises and they go to work. Buses, trains and taxis, all packed with people needing to get to work in factories, shops and offices. For every worker, there are families who depend on them to bring home food, pay for school fees, buy clothing, and pay for electricity and water. Small babies and old folk who need to be cared for also depend on their parents or children to be able to work and provide them with shelter. Employers who run businesses and provide jobs depend on the employees to come to work and focus on their jobs. Businesses need to make money to pay their workers' salaries. To keep their jobs and be sure of getting increases and promotions, workers must look after their health. But it's very easy to become ill. Public transport is always overcrowded. Taxis packed full, trains and buses with standing room only. Germs and viruses are everywhere. At work, people are close to each other. Many workers deal with customers and members of the public all day. What happens if you fall ill and can't go to work or afford to see a doctor? Who will pay the bills if you're seriously ill and off work for a long time through no fault of your own? Without proper attention, minor ailments can become major illnesses.
Prompt treatment can avoid the complications developing of any viral upper respiratory tract infection developing into something more significant.
If you can't afford proper medical care, life can suddenly become very difficult. We all know of someone who is unable to work because of ill health. Until now, good medical help has been for the privileged few who could afford it. Workers like you haven't been able to protect their health properly. Until now, if you wanted to see a doctor or dentist, you had to wait forever for an appointment at state clinics and hospital. And even then, you probably had to come back another day and risk losing your job, or at least several days' pay. It was easier to stay sick and hope things came right by themselves, which is a dangerous thing to do. But with OCSA Care, all this has changed. Occupational Care of South Africa, or OCSA, has the answer you've been looking for. Easily accessible, professional medical care at an affordable rate. No more wasted time in queues far from home and work.
And if I go, it's about an hour and then I'm back at work.
The benefit of OCSA Care is to give the patient the benefit of being able to see a private GP and get the same kind of care that patients on the private medical aids can get, and don't spend the whole day at a doctor's office or at the clinic.
Now you can book a convenient time to see a doctor and you don't need to pay cash.
If you've got a cold, you don't have, or flu, you don't have to pay a 200 rand for the medicine. So that's a relief for us and also for the boss.
OCSA, in association with the Carecross Health Group, have created a medical plan especially for the people of the nation's workforce who have not been able to afford private healthcare before. It has long been known that if you take care of your body, it will fight off illness and recover from injury far quicker.
It's very important to take care of your health by seeking medical attention at the first signs of illness. If you fail to do so, you'll find that your symptoms become worse and that you have to take off time from work unnecessarily.
The OCSA Care medical plan will enable you to stay healthy with no fuss and very little cost. As a member of OCSA Care, you will be able to visit a private doctor, dentist or optometrist near your place of work or near your home. If you need blood tests or x-rays, these will also be done for you, either at the doctor's rooms or at a facility he refers you to. Once the doctor knows what is wrong with you, they will provide you with medication at no extra cost. The optician will perform eye tests and supply you with spectacles with clear lenses and basic frames. The dentist will perform cleaning, filling and extractions. Now, thanks to OCSA Care, you're able to visit the doctor whenever you are ill. The optometrist will see you every 24 months for basic optometry with a 6-month waiting period. None of these things will cost extra, and they will all be available at a place close to you.
There are quite a few CareCross network providers in the area, and there's always one close to your home or your workplace, so there's no need to travel for hours.
We have stores all over the country in some very remote areas, and the thing that suited us was that there's a wide network of doctors, dentists and optometrists all over the country which our staff could go and visit, as opposed to going to a clinic, which is huge absenteeism problems that we face because they have to queue up the whole day, and that alleviates that very big problem that we have.
When you join OCSA Care, you'll receive a membership card that only you will be able to use. When you visit the doctor, dentist or optician, he will use the card to access your details on the OCSA Care system.
With a CareCross card or any option that's got a CareCross link to it, is seen as any normal medical aid coming in the door. The membership will be verified with the medical aid, and from there we will get an authorization number to say that they are active on the medical scheme and can be seen by a doctor that's got a contract with CareCross.
They will also use the system to claim their payment for the consultation and any medication they might give you. You don't pay anything. It is important to remember that you will not have to carry cash to pay for an ordinary visit to the doctor, dentist or optician. Your OCSA Care plan takes care of your visit and any simple operation that the doctor may have to do. For example, you may need stitches in a cut hand, or if you break your arm, the doctor will put a plaster cast on it. For more complicated procedures, the doctor will refer you to a surgeon at a state hospital. When a doctor needs to prescribe medicine for you, they will do this from a list that OCSA Care has compiled. Medicine on this list is given to you free. If you need medicine that is not on the list, the doctor will tell you, and you will have to pay for the medicine yourself. In some cases, people have problems that need treatment for a very long time, or for the rest of the person's life. These are called chronic illnesses and have to be treated with special medication. Where this happens, the doctor will do an assessment on you and complete a chronic medication form. The form will be sent to OCSA Care for approval. OCSA Care has an extensive list of medication that covers treatment for most of the chronic illnesses, such as asthma, epilepsy and diabetes. If the medication you require is on our list, we will supply you with it for free as long as you need it. There are certain conditions that require what is called a waiting period. This period is a safeguard for OCSA Care. It prevents people abusing the scheme by receiving free treatment and then leaving without making any contributions. Waiting periods apply to dental and eye care and to conditions that require chronic medication.
Absenteeism is a huge issue to us, and we see this as an opportunity to lower our absenteeism levels.
Another insurance mechanism OCSA Care has is its database, where our health professionals log all the visits made to them by OCSA Care members. This database allows us to track the health of all our members and to see when someone starts visiting the doctor very frequently. If this happens, we will contact the person involved and find out what the reason is for all his visits and whether they require special attention. These safeguards are needed because if people are allowed to abuse the system, the whole scheme would collapse, and medical assistance at this level would not be possible.
As CEO of OCSA Care, I have to agree with our Minister of Health in the sense that bringing private health care to all in South Africa cannot just be a government problem. It also resides with the private industry in South Africa. We have proven over the last 3 years that this solution and bringing private affordable health care to all in South Africa is possible. We bring medical care to people, but what we really also do is bring hope to our members. people don't need to fear of illnesses and being ill. They can now, whenever they are sick, access a private quality doctor in South Africa. And the benefits thereof is job security. Many of our members now don't need to fear that they're going to be absent all the time and that there's going to be issues with sick notes. They can simply go and visit our doctors, get treated for their illnesses, become healthy, and then obviously have a quality of life and life longevity. At OCSA Care, we believe that we do health, we look after your health, we look after your best interest, and your company and you can look after business.